Hello there. This section is actually an extension of the previous section. I'm going to talk about the coronary angioplasty or percutaneous coronary intervention, which basically means treating the narrowing of the blood vessels in your heart with a stent. As I said in the previous section, that once we find if there is a narrowing, we have to decide based on a number of scientific backgrounds that you need medicines or stents or the bypass. 70 to 80% of the patients, they end up having stents if there's a narrowing. Through the same risky procedure, through the same tubes that we have, and whilst you're still on the table, if we assume that we have a narrowing in one of these blood vessels, we can spend another 10 minutes, put a little balloon in there, put a little stent, and your artery is back to normal. So the narrowing could be 90%, it'll go to 0% at the end of the procedure. However, like any procedure, there are little complication risks. For example, the risk of bleeding, the risks are of also to damage to the blood vessels as well. However, these risks are very small, less than 1%. And the risk of heart attack in case of leaving these narrowing blood vessels is very, very high. And therefore, it's very important that once you have been proposed the PCI, you can proceed, because in today's world, it's a very simple procedure. What you have to make sure is that you take your medicines, particularly the aspirin and the aspirin's cousin called Plavix, regularly at least for 1 year. Generally speaking, people stay one more night and the next morning they are gone home. They need a regular follow-up on a monthly basis with their cardiologist. This procedure is done to open the blood vessels in acute as well as chronic settings, so in angina as well as heart attack patients. However, in heart attack patients, we tend to do that as an emergency, so sometimes we have to do that in the middle of the night. Having said that, the bottom line is that it's a very safe procedure, and this day and age, the stents are very safe. All you got to do is to have it done as soon as possible if you have narrowing the blood vessel, and keep your medicines on a regular basis.